I'd like to talk to you about dental implants for a moment. Phenomenal technology. I think dental implants are probably the thing that has been the greatest change in dentistry in the last 100 years. Some people call it almost a third set of teeth, in that we can go in and place a synthetic root back in the bone, build a tooth on it, and you'll function just like a normal tooth. You have a single tooth on a root, you can floss around it, and it feels like a tooth. And let me tell you why that's so important, is that we lose, in our jaw bones here, there's a certain amount of the bone that is there to hold a tooth in. And so you've got that root in the bone, and when you lose that tooth, that bone resorbs down rather quickly. Actually, the research shows that you have 25% bone loss in the first year and 40% in 3 years. And that's why if we can catch a person right when they're going to lose that tooth, we can stop that bone loss, place an implant right away or within 6 months, and then build a tooth on that, and they can have a tooth the rest of their life again. Implants also are the longest lasting restoration that we do in dentistry. We actually don't quite know exactly how long they last. They've been around since the 70s in practice, and some of those are still in the mouth. And so I tell people 30 years, quite easily could be 40, 50, and beyond. So they're just an amazing restoration that if you ever lose a tooth, that is the way to replace it. The other option there is, if you, let's go with a single tooth advantage. If you lose one tooth, you place an implant back in the bone, put a tooth on it, you're right back where you were. You have, again, a tooth on a root. It just happens to be a synthetic titanium root. The other option traditionally was to do a bridge. Now with a bridge, you have to grind the two adjacent teeth down to place that bridge. Insurance studies show that the average bridge in this country lasts 11.7 years, or roughly 12 years. So if you do a bridge, it lasts 12 years. What happens at year 12, on average, is that one of the teeth that are supporting the bridge fails. It gets decay. It usually ends up needing a root canal. And then you have to have a new bridge, plus the root canal. 10 to 12 years later, same thing. Sometimes the root canal will fail and you'll end up losing the tooth. The number one reason why we place implants is because a root canal tooth failed. Root canals are an excellent choice to save a tooth, and we always do that if we can. But root canals are more brittle, and so they don't last as long as a natural tooth. So oftentimes we'll get a fractured root or a recurrent infection that will end up being lost, and then we look at doing an implant. So that's kind of just the reality of this domino effect that occurs. So if you lose a tooth, go to a bridge 12 years later, root canal and a new bridge 12 years later, you lose that tooth that's supporting it, that has the root canal, and you now have a longer bridge, and it goes on and on and on, and before you know it, you've lost 3 or 4 teeth, and you have a removable partial denture. We don't like to see that. And also you're looking at, over that 30-year time, you've paid for 3 bridges, a couple of root canals, maybe an extraction, so your cost long-term is a lot more with bridges than with implants. If you place an implant right when that tooth comes out and put a crown on it, the cost of that is comparable, about the same typically, as doing a bridge. So the implant is always the best option, and long-term it's going to end up being about 1/3 the cost of the bridge work. So I definitely recommend implants. That's what I would have in my own mouth. Implants also have some other great treatment modalities. For example, you can place a couple of implants underneath an existing denture to just act as a retentive device. You kind of like a trailer hitch, you can snap onto a couple of implants and hold a denture in place. It's a very popular option for people who have had dentures for a long time and their dentures are constantly loose, so we can get that retention back. It's not the best option in those cases because we're still putting pressure on the gums with the denture. And we do know, again, when we lose teeth, we lose that bone. By placing implants back in, we stop the bone loss. Now, if we only place a couple to snap in a denture, you're still resting the denture on the tissue, so you're still going to have bone loss. If we can place multiple implants in and put a fixed bridge on top of the implants, you're going to get the load on the implants completely of the bite force and off of the tissue, and then you'll actually stop the bone loss process. So that's the best option in people who are missing teeth, is to get something fixed in the mouth where you're not asking the tissue to help support it. But that option with the snap-on is a good option for people who don't want to go to the extent of having something fixed in the mouth. So there's some great options with implants, whether it be the single tooth, a couple of teeth, or a full arch to replace a denture. So if you know anybody, please let them know about the implant options, because it really is a phenomenal life-changing modality, in that there's a huge psychological benefit when you go from removable teeth to having something fixed in your mouth. And people really comment on, with implants, it feels like their own teeth. So psychologically, they're feeling like, gosh, I've got all my own teeth. And so there's self-confidence that comes back, versus someone who has a denture in and is uncomfortable taking out. And it's an awkward situation for them, and I feel for those people. One other thing about that modality with implants is that in today's day with implant dentistry, there's a lot of different scenarios that are going on. And just like with any procedure, depending on the dentist's level of comfort and their training, they will opt to not do certain procedures. So a lot of general dentists will refer out extractions, they'll refer out root canals, they'll refer out implant placements and things of those nature based upon what their training and comfort level is. In our office, I've been trained to place implants, and we've been placing implants now for almost 10 years. We placed, I don't know the exact number, but hundreds of implants in the few hundred range. We have a 99.5% success ratio. I use an implant company that is based upon research principles of creating designs where things are going to last the longest in the mouth. And so I want people to know that our level of training here, I went to Dr. Carl Misch, and when I was interested in doing implants, I talked to some colleagues in dentistry who have been doing implants for a long time, and his name kept coming up. And Carl Misch is, I kind of call him the father of modern implant dentistry. He's the man who wrote the textbook on implant dentistry, which has been the #1 selling textbook in dentistry. He's the man that the King of Qatar called when he needed implants. The Pope called, Pope John Paul, not the current Pope. The Pope called when he needed implants. And he is the father of implant dentistry. So I said, I'm going to choose a mentor who I can really learn the best techniques from. And I actually did a year residency under Dr. Misch. I received the fellowship in the International Congress of Oral Implantologists doing that. So I want you to know, when you come here, I see some real advantages to having your implants done here. Not only because of our level of training and knowledge, but also because we do both the placement of the implant and the restoration. And in doing that, we're able to design the whole plan, look at where the ideal placement of the implant is for the restoration, and build that all in unison so that we get phenomenal results. And again, with the design we use and our techniques, our success rate is amazingly high. And I'm very proud of that, and it's actually very common amongst Carl Misch's students because of the level of training that he provides. So it's a wonderful treatment option, and I recommend implants for any time there's a missing tooth because of that.